Welcome to Medic-AI Euphonia Ebony Podcast.
Glad to be here.
We're all about health awareness here
Right?
and making medical education accessible
Yeah,
to everyone, you know.
Absolutely.
Today is World Epilepsy Day,
it is.
February 10th, 2025. And we are dedicating this episode to epilepsy, this often misunderstood neurological condition.
Yeah.
Listeners out there,
Mm-hmm.
whether you are a med student prepping for exams
Right.
or just someone who wants to know more about epilepsy,
Yeah.
stick with us because we are going to cover a lot.
Absolutely. A great topic, and it's a great day to focus on it. Yes. It's more common than a lot of people realize. Okay. Affecting millions globally.
Really? Wow. Okay, so
Yeah.
first things first, let's define epilepsy.
Okay.
I was looking through our sources and I'm seeing different definitions.
Mhm.
Dr. Marwa emphasizes having more than 2 unprovoked seizures,
Yeah.
while Ninja Nerd is focusing more on the recurrence aspect,
Right.
like it happening over and over again.
I think you've hit on a key point there. The difference between a single seizure and epilepsy as a chronic condition.
Okay.
So a seizure is kind of like a sudden power surge, a single event.
Okay.
Epilepsy is more like having faulty wiring that causes those power surges to happen repeatedly.
Okay, that's a great analogy.
Yeah.
That makes a lot of sense.
Hopefully.
Yeah, and that helps make sense of why some sources define epilepsy as a disease of continuous recurrent seizures.
Yeah, exactly.
Now, Ninja Nerd gets into different types of seizures.
Mm-hmm.
He talks about focal, generalized, and epileptic spasms.
Yeah. 3 big buckets.
Can you break those down for us a little bit more?
Absolutely. So focal seizures, you can think of them as like a short circuit in one specific neighborhood of the brain.
Okay.
And they can occur with or without loss of consciousness. Okay. And the symptoms depend on where it is. So if it's in the motor cortex, you might see like jerking movements of one limb.
Okay.
Generalized seizures, though, are more like a citywide blackout affecting both sides of the brain right from the start.
So focal is localized
Yeah.
and generalized is widespread.
Yep. Makes sense.
That makes sense. Now, Ninja Nerd mentions tonic-clonic seizures as a type of generalized seizure.
Mm-hmm.
Are those the ones that most people picture when they think of a seizure or epilepsy?
Yes, those are the classic seizures with the stiffening and jerking movements. Okay. What used to be called grand mal seizures. Okay. But there are other types of generalized seizures too, like absence seizure.
Right, those are the staring spells
Yeah.
that Ninja Nerd calls patimel.
Yeah.
And Dr. Marwa mentions that they can cause problems for kids in school
Mm-hmm.
because they often get mistaken for daydreaming.
Yeah, absolutely.
Okay, now what about those epileptic spasms?
Yeah, so those are less common, but often more severe. And he mentioned some pretty serious ones like West syndrome and Lennox-Gastaut syndrome. Those can be very difficult to treat. Really. Lennox-Gastaut especially sometimes requires a combination of medications and other interventions like vagus nerve stimulation.
Wow. Okay, that sounds intense. So now this is where I think it gets really interesting. What causes all of these different types of seizures?
Yeah.
Ninja Nerd has this mnemonic vitamin DE,
Right.
and it's packed with potential culprits.
It is.
What does all that stand for?
So it's a handy way to remember the wide range of things that can cause seizures. So it stands for vascular, infectious, trauma, autoimmune, metabolic, idiopathic, neoplasm, drugs,
Okay,
and eclampsia.
so we're talking everything from a stroke or meningitis
Yeah.
to low blood sugar or even a brain tumor.
Exactly. It's really a broad range, and that's why a thorough medical history and workup is so crucial when someone presents with a seizure. Makes sense. Because identifying the underlying cause is key to effective treatment,
Okay.
which might not even require anti-epileptic drugs if it's something that's treatable.
Right, that's a great point. And actually, Dr. Fazal mentions that first-time seizures usually don't require medication unless there are specific red flags like an abnormal EEG or strong family history.
Yeah, that's true.
Speaking of EEGs, those are used to detect abnormalities in brainwave patterns.
Precisely. It's like we're looking at the electrical activity of the brain, but to see if there are any unusual patterns that could indicate a tendency towards seizures.
Okay, so we got the basics down.
Yeah.
Now, I know you can't diagnose or treat anyone through a podcast.
Of course.
Let's talk about how we actually manage epilepsy.
Mm-hmm.
We've got Speed Pharmacology here and Ninja Nerd both diving into how anti-epileptic drugs or AEDs work at the cellular level.
Okay.
And it seems like it all comes down to these 2 neurotransmitters,
Yeah.
glutamate and GABA.
Yeah, you got it. Okay. So remember, glutamate is kind of like the brain's accelerator.
Okay.
It excites neurons and promotes communication. GABA, on the other hand, is the brake pedal.
Right.
It inhibits neuronal firing, keeping things under control.
So what's happening during a seizure then, in terms of these neurotransmitters?
So essentially, there's an imbalance.
Okay.
Too much glutamate and not enough GABA can throw that whole system out of whack
Okay.
and lead to that uncontrolled electrical activity that characterizes a seizure.
And that's where the AEDs come in. Speed pharmacology explains that many of these drugs work by either dampening glutamate's effects or by boosting GABA's activity.
Yeah,
It's like they're fine-tuning the brain's electrical system to try to prevent those surges from happening.
exactly right. So some AEDs block sodium or calcium channels involved in glutamate release.
Okay.
Others prevent glutamate from binding to its receptors. Then you have drugs that work on the GABA side, either mimicking its action, preventing its breakdown, or increasing its availability.
It's really fascinating how we can target these specific cellular mechanisms
Yes, it is.
to actually control seizures. But I imagine choosing the right AED for a patient can be tricky,
Yeah,
given the variety of seizure types
right.
and potential side effects that they can cause.
It absolutely can be. Yeah. And that's where a deep understanding of these drugs and their mechanisms of action becomes crucial for us medical professionals. So knowing which AEDs are generally preferred for different seizure types is a good starting point.
So, for example, Ninja Nerd mentions carbamazepine and oxycarbazepine as common choices for focal seizures.
Great.
Okay.
And for generalized tonic-clonic seizures, there are options like valproate, levetiracetam, lamotrigine.
So many options.
There are.
Okay.
It's important to remember those are just general guidelines.
Yeah.
Dr. Faisal stresses that treatment needs to be individualized,
Okay.
taking into account the patient's specific type of epilepsy, their medical history, and potential drug interaction.
So it's not a one-size-fits-all approach.
Definitely not. And we can't forget about those rarer and often more severe cases. For instance, epileptic spasms often require specialized treatment.
Right.
Ninja Nerd points out that vigabatrin is specifically used for West syndrome, while Lennox-Gastaut syndrome often requires a combination of medications or even vagus nerve stimulation.
It sounds like managing epilepsy requires a lot of careful consideration
It does.
and a really deep understanding of the available treatment options.
Absolutely. And sometimes, despite our best efforts, seizures continue or the side effects of medications become too much to handle.
Yeah, I can imagine.
So in those cases, doctors might need to adjust the treatment plan. Dr. Faisal kind of walks us through some of the steps involved, like increasing the dosage, tweaking the timing, switching medications, or even adding another drug.
So it's like a constant process of monitoring, adjusting, and fine-tuning
It is
to try to find the best approach
for that individual.
for each person.
Yeah,
It's fascinating how much goes into managing this condition.
it really is. And there's so much more to explore,
I bet.
from managing side effects to exploring alternative treatment options like surgery.
Right. We've talked about those first-line treatments for different seizure types.
Right.
But I'm curious about what happens when things don't go as planned.
Okay.
Like, what if someone's diligently taking their medication, but the seizures aren't controlled,
Yeah.
or the side effects are just too much to handle?
That's a crucial aspect of epilepsy care. It's not always a straightforward path. Yeah. Dr. Faisal really emphasizes a structured approach in these situations.
Okay.
And it starts with a thorough assessment to try to understand the frequency and the nature of the seizures
Okay.
and to confirm medication adherence.
Right, because missing doses can throw things off completely.
Oh, absolutely.
I imagine it's like forgetting to water a plant. Eventually, it's just going to wither.
Yeah.
So if adherence isn't the issue, what are the next steps?
So that's when we start exploring adjustments.
Okay.
And the sources mention several possibilities, like increasing the dosage, tweaking the timing of the doses, or even switching to a different medication.
So it's about finding that sweet spot
Yeah,
between effectiveness and tolerability.
yeah, you got it.
And I'm guessing that's where those side effects that we talked about earlier come into play.
Absolutely. So if a particular medication is causing significant side effects, the doctor will try to find an alternative that's better tolerated while still being effective
Right.
against the seizures.
Right. So it's a delicate balancing act.
It is.
It sounds like it.
Yeah.
Now, something I've always wondered about is whether people with epilepsy can ever stop taking medication
Yeah.
altogether. Is that even a possibility?
In some cases, it is. Dr. Faisal mentions that stopping anti-epileptic drugs can be considered after a person has been seizure-free for 2 to 3 years
Okay.
and has a normal sleep deprivation EEG.
Oh, right. The sleep deprivation EEG.
Yeah,
It's like a stress test for the brain's electrical system.
exactly. They intentionally disrupt your sleep, to see if it triggers any abnormal activity.
Wow. Okay, so even with a normal result, the decision to stop medication is a big one.
Huge.
It should always involve discussion with the doctor.
Absolutely.
Yeah.
Yeah, they'll consider the type of epilepsy, the individual seizure history, other factors before making a recommendation.
Makes sense to take a cautious approach.
Yeah,
Now we've focused a lot on medication,
right.
but I know there are other treatment options out there. Ninja Nerd mentioned vagus nerve stimulation, or VNS.
Yeah.
For those really tough to treat cases, what can you tell us about that?
So VNS is a fascinating procedure
Okay.
where a small device is implanted under the skin and it sends regular electrical impulses to the vagus nerve,
Okay.
which runs from the brain all the way down to the abdomen. And it's kind of like a little tune-up for the brain's electrical system.
And this can actually help reduce seizures?
It can,
I would never guessed.
especially for people who haven't responded well to medication or who aren't good candidates for surgery.
Okay.
Ninja Nerd mentions it being used for refractory focal seizures, Lennox-Gastaut syndrome,
Okay.
and some cases of uncontrolled generalized tonic-clonic seizures.
So while it's not a first-line treatment,
Mhm.
it's definitely an important tool in the epilepsy toolbox.
It is.
What about surgery? That seems like a pretty drastic option.
It is. It is. And it's only considered in very specific situations.
Okay.
Dr. Marwal talks about epilepsy surgery, where they actually remove the part of the brain causing the seizures. Okay. But this is only an option when the seizures originate from a well-defined area that can be removed without causing significant neurological problems.
Wow, that sounds intense.
Yeah.
But I can imagine it being life-changing for someone who's tried everything else
Yeah,
and is still experiencing those debilitating seizures.
it absolutely can be. But it's important to remember that surgery isn't a cure, right? There are risks involved. And even after surgery, some people might still need medication.
Okay, so we've covered the spectrum of treatment options from medication adjustments to surgery, but what about things that people with epilepsy can do in their everyday lives to try to manage their condition?
Yeah, so there are lots of things that people can do to take control of their health.
Okay.
And it often starts with identifying and managing triggers. We've talked about some of the common ones like sleep deprivation, alcohol, and stress. But it can be really helpful to keep a seizure diary, to track patterns and uncover individual triggers.
So it's about paying attention to your body
Mhm.
and noticing what might precede a seizure.
Exactly. Once you know your triggers, you can take steps to avoid them or minimize their impact.
Okay.
For example, if you notice that missing sleep tends to trigger seizures,
Yeah,
you can prioritize good sleep hygiene,
makes sense.
establish a regular sleep schedule.
It's about taking proactive steps to manage your condition.
It is.
What about things like diet and exercise?
Mhm.
Do those play a role?
They can. A healthy, balanced diet is always a good idea.
Right.
And some people with epilepsy find that certain foods might trigger seizures.
Okay.
So it's all about paying attention to your body's response.
Right. It's that individualization again.
Exactly.
What about exercise?
So regular physical activity is generally beneficial for people with epilepsy. It can help reduce stress, improve mood, promote overall well-being.
Okay.
But it is important to choose activities that are safe
Right.
and to avoid overexertion, which can sometimes trigger seizures.
So common sense goes a long way.
It does.
Are there any other tips you'd recommend for people living with epilepsy?
So one thing that comes up consistently in our sources is the importance of open communication.
Okay.
Talking to your family and friends about your epilepsy, helping them understand what it means for you, how they can support you, right? That can make a world of difference.
Right, because having a strong support system is crucial for managing any chronic condition,
It is.
especially one as unpredictable as epilepsy.
Absolutely. And don't forget about the resources that are out there.
Okay.
Organizations like the Epilepsy Foundation offer a wealth of information support groups and advocacy services, right? So they can connect people with epilepsy to others who understand what they're going through, right? And provide guidance on navigating the various challenges of living with this condition.
That's so important. Knowing that you're not alone in this journey can be incredibly empowering.
It can.
Yeah.
And for our med student listener, remember that your role as a future healthcare professional goes beyond just diagnosing and treating epilepsy.
Okay.
It's also about providing compassionate care,
Right.
educating patients about their condition, and empowering them to take an active role in managing their health.
It's about being a partner in their journey,
Exactly.
walking alongside them and helping them navigate all the complexities of living with epilepsy.
Now, while we've covered a lot of ground on the medical aspects of epilepsy, we can't forget about the human side of this condition.
Right. Free medication actually mentions
Yeah.
that there are people from all walks of life
Right.
thriving with epilepsy, doctors,
Yeah.
engineers, even pilots.
Yep.
But I imagine it takes a lot of resilience
It does.
and a strong support system.
Absolutely. Having open and honest conversations with family, friends, and even colleagues, right, can help create that supportive environment. Yeah. And it's about educating those around you about epilepsy so they understand what to do if a seizure occurs and they can offer help when needed.
That makes a lot of sense. It's about building a network of understanding and support.
Yeah.
But I'm also thinking about the internal challenges. How do people with epilepsy cope with the unpredictability
Right.
and the potential stigma that's associated with the condition?
That's where finding healthy coping mechanisms becomes crucial.
Yeah.
Our sources emphasize, the importance of things like stress management techniques, mindfulness practices, and even therapy. But remember, epilepsy doesn't just affect the body. Right. It can take a toll on mental and emotional well-being as well.
Absolutely. Are there any specific resources or organizations that you'd recommend for people who are looking for support and connection?
Absolutely. The Epilepsy Foundation is a fantastic resource. They offer a wealth of information support groups and even legal advocacy for people with epilepsy. So connecting with others who understand the unique challenges of living with epilepsy can be incredibly empowering and validating.
It's that sense of community and shared experience that can really make a world of difference.
Absolutely.
Now, what are some key takeaways
Yeah.
to carry into future practice?
So first and foremost, remember that each person with epilepsy is unique.
Right.
Their experiences, their challenges, and their needs will vary. So take the time to listen to your patients, understand their individual circumstances,
Okay.
and tailor your approach accordingly.
So is that seeing the person beyond the diagnosis?
Exactly. And don't underestimate the power of empathy and compassion.
Yeah.
A supportive and understanding healthcare provider can make a world of difference in a patient's journey with epilepsy.
Absolutely. Now, as we wrap up our exploration of epilepsy, for a healthy life, both calm and exuberant. Thank you for joining us on Medicaid Euphonia Ebony podcast. We're committed to breaking down barriers and bringing you the knowledge you need to thrive. We'll see you next time.